So, could you please introduce yourself and tell us your career path in the professional field of social work?
I'll start first. So my name is Coffey. I qualified as a social worker in 2003. I went into social work after second level education in Ireland. So I started my training at age 18 and I finished at age 22. And since I worked in social work from then until now. I've worked in the fields of adult mental health, in a specialised addiction service, in probation, primary care, in a specific elder abuse service in a community setting. And I currently work in a non-acute hospital setting in Dublin, primarily for older people. So that's me and my journey into social work.
Great, thanks.
Okay, so unlike Aisling, I was in my 30s when I went back to college to study social work. I had another career before that, and my social work time, I'm now out of my day job, and but nearly all of my work has been in hospital settings, acute hospital settings, and I did also work in a residential care setting for older people and for people with a learning disability. And so I've been retired a number of years now. So my main focus these last years has been on my own association, our association, Aisling and mine, and the Federation. So that's me.
Great, thanks. What do you do in the professional associations? Maybe what your tasks or your work there?
Yeah, so I'll start. So I'm a proud member of the Irish Association of Social Workers, and over the years I've held different roles within the association. We have special interest groups. We have a special interest group in primary care and in ageing and in other fields. I was secretary for the special interest group in primary care in 2009. More recently, I was treasurer for the Irish Association of Social Worker, and then vice chair. And then for about 3 years, I was the chairperson of the special interest group in ageing. What strikes me about our association is the spirit of volunteerism and the efforts that ordinary social workers, like all of us here, go to support our service users and to raise issues of importance on behalf of our service users and on behalf of the profession. So I'm struck by the volunteerism, very impressed by it, and being a member of the Professional Association has been instrumental to my professional development.
Same.
And I've been a member of the association since before I qualified. I was a student member initially, and then I became a full member of the association. I then went on, I was on the board, which was before, now it was an executive, a voluntary executive, and then it became a board. And latterly, I was vice chair, like Aisling had been, of the board. And I came off the board last year. In the between times, I was chair of a number of committees, the International Committee of the Association, hence my involvement with the Federation. And my particular interest when I was a practicing social worker was in the area of social work and older people. So I was the chair of the Special Interest Group on Aging for a number of years as well. And now my commitment is mainly to the Federation, but I still remain a member of my association, and also the International Committee is of the association. So I'm an ordinary member of that now, and put a lot of focus on the Federation in Europe.
Great, thanks for that. Now I'm going to the topic we are talking about. For the past 2 years, no other issue has preoccupied the world as much as the Corona-Pandemic and its impact on society. So my question is, how do you feel the link between the pandemic and poverty in your country?
Okay, I'll say a few words on that. There was always a high level of poverty in Ireland prior to the pandemic. The pandemic, I think, like in all other European countries, maybe countries across the world, the pandemic has increased that level because of people losing their jobs and not being able to basically fund family life. So the incidence of poverty and people at risk of poverty is quite high. It's about 13% in Ireland around now of people living in poverty. In Europe, there's probably around 18 million children in poverty. Quite a large number of children in poverty. And coronavirus, because it sort of disrupted society so much across so many fields, from social services, education, housing, and employment, it has pushed more people and exacerbated the bad situations that people are in. And that's been the biggest effect, I would say, of from a poverty point of view, of the coronavirus. And I think it's similar across Europe, different degrees, and each country is slightly different in the effect. But nevertheless, broadly speaking, the fact that people were pushed out of jobs because of everything was in lockdown created huge problems and pushed people into homelessness, for example, and that's a problem. So that's my short answer. Please follow up with any other questions you have about it.
And I work primarily with older people, and I suppose what we noticed kind of in the early stages of the pandemic was, with the closure of community-based supports for older people, increasing numbers of older people were becoming quite isolated at home, so they weren't attending their day centres. Because of the isolation, there was an increasing loneliness, wasn't a lot of cognitive stimulation, which for some led to advancement of their cognitive impairment. And also, I suppose, for carers who were already under a lot of stress trying to care for a loved one at home, they were cut off from many of their key supports as well: carer support groups, access to respite services, access to day services for the loved one. Those services would have played an instrumental role in helping those individuals to care for a loved one. And with their initial withdrawal, that caused a huge burden on already stretched family members trying to care for a loved one. That's what we would have noticed in the older person's services. We did also notice a great volunteer effort in terms of many services. Say, for example, day centres switched to delivering meals to clients' homes, which was wonderful, and they also switched to reaching out on a one-to-one basis, doing telephone befriending and engaging with people at home. But nothing actually matches meeting a group of your friends in a setting where you're all together, and that's what people missed out on for 1 to 2 years.
Yeah, and I think also the fact that people couldn't meet face to face meant that there was a lot of telephone or computer, digital basically, contact. But that actually puts those people who don't have computers or laptops or iPads and so on, or who are not familiar with using them, that puts them at a disadvantage, and it's something for the future that we all need to across Europe, and that we need to pay attention to, that people need access to digital equipment in order to be able to communicate. Yeah. I think hybrid work will happen for a while more, so.
How has the pandemic affected the work as social worker in your country?
Well, perhaps I'll start. So I work in a service for older adults In the service, we have a rehabilitation hospital for older people, a day hospital, which is an outpatient department, and a nursing home on site. So early in the pandemic, we experienced an outbreak of COVID-19 in both our hospital and our nursing home setting. And our role as social workers changed dramatically overnight. We were dealing with a large volume of our service users, clients who were quite unwell, and their families and key supports who were unable to visit them at this crucial time. So we worked alongside our multidisciplinary colleagues, and the social work department brought in a new model for responding with dignity to the needs of our service users at end of life, responding to their spiritual, emotional and social needs. I'm proud to say that our profession was on the front line during the outbreak in our service settings, and we were contacting families by phone and explaining to them what was happening in our setting. We were explaining to families of some of our residents who were quite unwell the nature of COVID-19, and we were giving them the chance to prepare for end of life. And when a service user was approaching end of life, we were engaging with families to ask them what they would like us to do on site, given that they could not always be present. And we would have asked them what kind and comforting words we could whisper in the residents' ears. We asked them what possessions of significance we could place in the residents' arms, close to their heart, be it photos of a wedding day or a teddy that a child had given them, or rosary beads or holy water. We would ask them as well what music would be important to be on in the room and at what volume. We would have asked them if prayer was important to their loved one, and we would have ensured, and we had a wonderful priest called Father Pat Myrna, who was actually working in the local army barracks, and he provided telephone spiritual support to us for our residents during this very difficult time. Residents themselves who were able to tell us what they wanted, we honoured their wishes also. Some wanted contact with their priests from home, and we arranged that. And for families who were able to visit, and if you think back to approximately 2 years ago, there was a huge amount of fear about COVID-19. We weren't 100% certain how it was spread, what the impact of it would be. So a lot of family members were understandably cautious about coming into a service setting that had an outbreak of COVID-19. They were concerned about their own health, and in some cases, they had vulnerable family members in their homes. For those that were able to visit, the social work department was on the front line, helping those family members to don and to doff PPE and facilitating visits to loved ones at end of life. For those families, for very valid reasons, who were not in a position to visit, we were offering those alternatives, be it phone contact with their loved one at end of life, or be it virtual contact with their loved one at end of life. And we asked our residents and families, look, what can we do for you? What is possible for us to do at this crucial time? You must remember that COVID-19 family would be with their loved ones at end of life. They'd be gathered around the bed, there'd be songs, there'd be prayers, there'd be hugs, there'd be lovely things said to one another. But because of COVID-19, all of that was taken away. So I'm very proud of our profession. We were on the front line with wonderful colleagues, nursing, medical, portering, cleaning colleagues, allied health professionals, healthcare assistants, etc. And we did everything within our gift to try and ease and to soothe what must have been a huge amount of distress for residents and families at that time. As things moved on and our setting came out of outbreak, social workers advocated with the service around visiting options for residents and families. We were advocating for the installation of pods, for example, so that visiting could be done in an infection control compliant manner. We also adapted our social work assessment tool around this time. This was around June or July of 2020. And we were engaging with residents specifically around COVID-19, the impact it was having on them, and what the service setting could do to help them at this time. I'm trying to think now, what else were we doing that was a little bit different? I suppose the work at end of life, Theresa, is probably, in my opinion, it's the most important work I've ever done in my entire social work career, because attending to the needs of somebody at end of life and trying to support their family is just so crucially important. And we were honoured to have been there at what was a very, very difficult and challenging and extremely sad time. But we were honoured to be there to offer support. And I'm delighted that we were, and I'm very, very proud of our profession for doing that on the front line. And obviously, we could not have done anything without the support of our multidisciplinary colleagues, who were superheroes.
Yeah, and I think where a lot of services were closed down because of COVID, I think social workers in general, as Aisling says, we kept going. As much as possible, and I think we were quite creative in ways in which we could engage with the people who are using our services. And I'm reminded of in a adult mental health setting, social work colleagues of ours were engaging with the service user by arranging to meet them outside on the street, and they would go for a walk. So they were both safe, keeping a safe distance. So they would walk and they would talk about where they would normally have gone into a room somewhere. So rather than just be on the phone or on a tablet or whatever, this is just one example of creativity and innovation. And hopefully some of that will continue. And from a federation perspective, I suppose the big thing was we moved to digital communication. So, for example, in 2020, we were supposed to have a conference, a global conference in Calgary. Mm-hmm. And that would normally be about 2,500 people would turn up, pay their fees and all the rest. So we had a free one, digital one, 20,000 people registered. I don't know whether 20,000 people actually engaged, but 20,000 people registered, where normally it would have been 2,500. And then last year we had quite a number of people again. There is going to be another online global conference this summer. There'll be a small charge for it, but that hybrid piece that will come down the track, I think will help people who are in remote places or who can't travel to engage with colleagues. So it's one of the positives of COVID, even though we'd all like to be in the room, and there's nothing better than that. But for many people, traveling in the old ways before COVID was very, very difficult, particularly where social workers' wages, salaries were not great. And many countries, even in Europe, a wealthy continent like Europe, there are many social workers whose salaries are relatively poor, low, and therefore they can never get the opportunity. And I think the other thing, from the Federation's point of view, we're engaged with a number of agencies across Europe who are, a lot of them are Brussels based. They're engaged with the EU around the kind of structural issues that put people into poverty and so on and so forth. And social services is a big area for them. But I do think that COVID hopefully will have changed public attitudes towards the social. So much of Brussels is about the economic and money. And the social always gets pushed down below the economic. And I'm hoping that people will have a better sense of community and sense of needing to be there for others, our common humanity, as it were, and that might help future. Who knows? We just don't know. But things like the European Pillar of Social Rights is in an implementation phase across Europe, and I'm hoping if that was put in place, things would be a lot better. And I'm hoping that there will be much more over the next few years, much more agreement and willingness to implement the social and to put it higher on the agenda at an EU level. And certainly the Federation will keep plugging away at that with colleagues in other, I think you mentioned the European Anti-Poverty Network in one of your emails, and we work closely with them around issues of poverty across Europe, and we'll be working on what they call a Poverty Watch report in the summer as a federation to look at across Europe at what's happening, and that will be 2 years of COVID. We did one 2 years ago, and the report was published at that stage. So,
thanks for your impression. There's a lot of challenges through this time, but also a lot of opportunities, like you said. And
I think what I'm hearing as well, Theresa, is that during the worst of times, our profession was there. And I know for us in the service setting I work in, the most important thing for us was our service users and their family. Mm-hmm. Make sure that their needs did not go unmet. And we did every single thing we possibly could to meet their needs. So we were there, we were on the front line, we didn't leave. And I'm very, very proud of our profession for doing that and for working with other professions during what was a really, really unprecedented, difficult time.
Yeah.
And I'm hearing that from what you're saying in terms of your work, Theresa, and also from the examples John was giving. Our profession was there and we responded.
Yeah.
Even our students. I was doing some tutoring. I gave it up there last year, but anyway, in the 2 years of 2020, 2021, I had students, and there was a short pause in the students' placements in agencies, but as quickly as possible, they were brought back into the agencies, and in some cases they could physically go in, but in other cases they worked via digital means. But there was a lot of creativity around how do the students get the experience of the placement. Obviously, it would have been far better to have been there in person all day, every day, whatever. But there was a huge amount of creativity for those 2 years of the two groups of students, and it was really good. And as Aisling is saying, the agencies, and a lot of them were in child protection and welfare here, and a number of the students I had, and it was fantastic to see how they coped, and social work kept going during that period, and how they were very creative about how the student could be actively involved with the users of the service to get that experience, you know. And they came out with flying colours. It was even the students were creative around how they worked, and that was brilliant, you know. Yeah.
Great. Thanks for all your answers.